There we go. So I'm Christy Bird McKeeve, and I'm the Executive Director of Butte-Glenn Medical Society. I am also the CEO of Healthy Rural California, but today we're on our virtual grand rounds with Butte-Glenn Medical Society, and we're very excited about our presenters. We're going to be talking about a really great program that helps children 0 to 3. Just a quick note about working in the Zoom environment. Please make sure that your audio is at an appropriate level that you can hear. And if you can't hear me right now, that means that something's amiss. Please keep yourself muted. The chat is a great way to ask questions to the group, especially if you're thinking about them. We tend to do breaks or follow up at the end and do review the chat to see if there's questions that are unanswered in there. We are recording this presentation. And again, if you have technical difficulties, it's just a good thing to log out and then log back in using that same link. Thank you to Enloe Medical Center for providing continuing medical education. There will be a follow-up email regarding CME. And we're going to have a few minutes with Enloe right now. Thanks to Jack Meyer. Bailey's on the call as well, and sharing the neurospine program. So take it away, Jack.
Thank you, Christy. Hello, everyone. My name's Jack. Obviously, I'm part of Enloe's community outreach team. In case this is the first time you're hearing from our team, our goal is to connect with our healthcare community and make sure our surrounding area is aware of different opportunities and resources available here at Enloe, as we're all working to the same goal of keeping our community healthy. My role also involves working with referrals and being a point of contact for questions or concerns. Our team has the opportunity to connect with most primary care offices in the 8 surrounding counties. So if you've seen some of our paperwork in your office, most likely me or Bailey has had a chance to stop by. I wanted to share some information regarding Enloe's neurosurgical and spine clinic. We've been taking the feedback of physicians like yourselves and heard there was some confusion on what type of referrals get approved and which get denied. We know that
the internet's so bad back there.
So I think I got muted.
Sorry about that. I was trying to mute someone else.
No worries. No worries. So not sure how much you heard, so I'll start just a little bit before, but we've been getting some feedback from physicians, and there's been some confusions about which referrals get denied and approved. We know that there's a variety of reasons why, but I wanted to share a couple of the main reasons. That way we can avoid some of those issues. Our clinic wants surgery to be the last stage effort, not the first stop. They look to see if the patient has attempted physical therapy and pain management. They'll approve a referral unless there are very specific circumstances that prevent such. This is because they found that about 90% of back pain can be resolved through these 2 methods. Both Enloe's physical medicine and rehabilitation clinic can be great places to send your patients who are experiencing back pain instead of going directly to neurospine. If your patient has tried these options and you think a referral is still necessary, please ensure that the patient has had an MRI or a CT scan of the area within the last 6 months. They require up-to-date imaging before they can accept any referrals to make sure the doctors know exactly what is going on when they triage the referral. I have a document that we created with more specifics about this that I'm happy to share with you. I'm going to go ahead and put my email in the chat. If you would like that, I can send it your way. Thanks.
Thank you, Jack. So now we have our presentation with Dr. Valdez and Michelle Lucero. Please go ahead and share your screen.
All right. Hello, everyone. Thank you for being here today and for allowing both Dr. Valdez and myself to present about Help Me Grow. I'm really excited to have this opportunity to spread the word.
Thank you, Michelle. So I am Dr. Lourdes Valdez. I'm a pediatrician in Butte County. I used to work at Northern Valley Indian Health, but now I'm working with Feather River Tribal Health and also a hospitalist at Enloe Hospital. I was sharing with the audience that recently completed my master's in public health. So very excited to, work collaboratively with, all members of the community regarding issues in children and the pediatric population. So the objectives of this lecture are to emphasize the importance of universal formal developmental screening, also to provide information of the screening tool use, methods of reimbursement, and best practices. And finally, recognize how this new program that we have started called Help Me Grow, Butte, is a systems approach that can impact children and families and help us serve better our pediatric population. Next.
I guess I realized I didn't officially introduce myself.
Sorry.
Whoops.
Go ahead, Michelle.
Yeah, so I am Michelle Lucero. I am the director for Butte County Office of Education, Child Development Programs and Services. I've been in this role for a few weeks. However, I've been on maternity leave. So I'm really officially in the office in this role for 4 whole days. Our previous director just retired. And we have been operating our Help Me Grow system here for live Help Me Grow system for about 1.5 years. So we're really looking forward to sharing this with you. All right.
And before we continue, let's go
ahead.
to the next slide. I also want to share that, working with Michelle, me being on the medical practice and Michelle being part of the Butte County Office of Education, it's been great because we're integrating 2 different areas of service to children. And actually that's the way to go. We really have to collaborate more between the different areas to be more effective on our screenings and interventions. Moving on to the presentation. So let's talk about the problem. So California's systems for early identification and intervention has been failing. Despite developmental screenings receiving more recognition for the important role it plays in helping to detect developmental, behavioral, speech, or motor delays, our state continues to be 30th in the country for screening in infants and toddlers, and 44th, it ranks 44th place for screening children below the federal poverty level. It is estimated that only 28.5% of children in California receive timely developmental screenings. And this is referring to formal developmental screening, not just asking, oh, does your kid talks, or, but using tools that can help, be systematic on detecting delays early. This puts a burden then later on the education system, because if we don't screen the children and identify the problems early when they get to school, then the burden that the school system has to deal with is much bigger when things could have been addressed earlier, and we can assure them that way better outcomes and more success for our children once they reach that kindergarten. So what can we do to ensure that children that have a delayed or that have mental or behavioral needs achieve their greatest potential? We can screen, and we can screen early, efficiently, and regularly, so we can change the child's trajectory. How can we do this? We can do these regular screenings in settings where children live, grow, and play since an early age. And pediatric offices and family practices offices or other practices that see children have a stellar position on this, because we see kids since they're newborn, and we follow them through childhoods. And we have a system that we regularly screen and detect this early and know also what to do with our positive screening. It's essential. And once we get these positive screenings, then we need a team that will help us help these kids. So Help Me Grow is when it comes in the equation to do this. Next. So what are the current recommendations from the American Academy of Pediatrics? They recommend that we should do a developmental surveillance during every well-child visit. And this means not using necessarily a formal tool, but you can ask, is your baby cooing, or is your baby smiling back to you? Those are important things. And if we see that something is not happening, then we can move on to the formal screening using validated tools that can help us, assess and diagnose or suspect a diagnosis at that time. The AAP recommends that we should use, regardless of how the kid is doing, a formal developmental screening at least at 9 months, 18 months, and at 24 and 30 months. So what are the tools used for this? The most common one are the ASQ3, that stands for Ages and Stages Questionnaire. And other tools include PEDS, PEDS. And for autism, we have this tool called MChat. And the recommendations for autism screening at this time is to do it at 18 and 24 months. Then once we detect a problem, then we do a referral for evaluation and early intervention services when we see that there is some things we need to follow up or a risk is identified. Next. So why is important? So definitely screening early and intervening early leads to more successful long-term outcomes. And sometimes there is a missing link. Okay, we screen, we do our part. We tell the parent, okay, call Far Northern and I'm gonna put a referral. And sometimes things fall through the cracks, or something happens and things don't get followed through, and we don't learn about it until the next well child. So it's very important to have all these connections. Then, as I mentioned, healthcare providers are often the first line of defense. We see these kids at every checkup. We do the checkups as soon as the baby comes out of the hospital within 48 hours, then at 2 weeks, 2 months, 4 months, 6 months, 9 months, 1 year, and then 15 months, 18 months, 24 months, and then more or less every 6 months to a year, depending on the case. When we do these screenings and we are following these families, they feel supported. And that support, that caring, that love that we give to our families is super important to work as a village to help these kids thrive. Next.
Yeah, I want to add to this that having the formal developmental screening from an early learning side, a parent oftentimes they're not an expert in children, and they don't understand developmental milestones. They don't know what is appropriate for their young child when they're born. There's no manual that comes with a child when they're born. Mm-hmm. And being able to have information such as the content that's in the ASQ really helps, because it's parent driven or led, really helps begin to open a door of conversation and understanding related to what their child might be doing and be expected to do at around the particular age. Mm-hmm. As well. So we're really equipping the parent as well to know kind of what's age appropriate.
Yeah. So this is a service that has a CPT code, ICD code, and there's some reimbursement attached to it. I am not in private practice, so I've been doing more like I don't do that billing directly, but basically my job has been to always document all these codes, so that that visit gets paid appropriately. Next.
So I'm going to talk a little bit about the Help Me Grow difference. Help Me Grow Butte is a part of Help Me Grow California, a larger system in the state, as well as the national Help Me Grow movement. Help Me Grow was founded in 1997 in Connecticut by a doctor. And since then Help Me Grow has really scaled and spread across the United States as an opportunity for developing early identification and intervention systems. So across the country, all Help Me Grow initiatives are working to provide outreach and education about available community resources, ensuring that children with developmental delays are identified and linked to resources early, help families and professionals navigate resource referrals through a centralized system, and collect and evaluate data to improve systems. Help Me Grow really recognizes that it is challenging to keep track of all of the resources that are available in a county, especially in large counties where there's a variety and multitude of opportunities. But even in a county such as Butte, there's a lot of resources that pop up on a regular basis. And for a physician to have to maintain that Rolodex in their brain, as well as being able to attend to the child during their limited amount of time during a well-child visit, a system such as Help Me Grow really provides that linkage and connection so that the physician can focus on the health and well-being of the child and refer a family or make a connection to Help Me Grow to be that Rolodex of information and get the right connection to service beyond just an early intervention such as Far Northern. So Help Me Grow Butte is represented by several agencies. It is funded through the first 5 Butte County Children and Families Commission and is made up of 3 entities. Butte County Office of Education is the lead agency, helping to coordinate the whole system. Northern Valley Catholic Social Services currently provides the care coordinator. So it's that live person that takes the phone calls or referrals from physicians or community providers and works with the family to get them connected to services. And then 211 is the centralized access point. So the one phone number that a family can call and get connected to basic needs services or Help Me Grow. They're the one, they're that maintaining that Rolodex in the county of all the services that are available. And that's their role, which really reduces the burden of all of us to have to know that information. So supporting families through Help Me Grow. Help Me Grow is a cross-sector system based approach that connects families to resources. We really want to make sure that children are thriving from an early age. Being in early childhood, and specifically we work in our department with children that are at 3. We often receive children who may have misdiagnosed, and so we're receiving them at 3 years old. And beginning to determine what types of supports they need, especially speech and language is typically what pops up as we receive children in our early childhood settings. But also a lot of behavioral concerns that might have been missed or misdetected early on that then we're trying to provide intervention at the age of 3 when we could have been working on it from birth or helping a family, coaching them with some skills to help support their development in the home. Help Me Grow builds and maintains a network of community resources, which I shared. We're really working hard to engage through effective outreach. This has been extremely challenging to outreach to the community during COVID, since face-to-face learning and outreach was not possible. But the best practice approach is to work with the child health providers and to create those connections and linkages, as well as community-based organizations. We want to make sure that we're supporting children in the early years so that they have long-lasting consequences for their health and well-being. Our services are really flexible and targeted to our community and the families that we serve. So although there's Help Me Grow systems across the state and across the country, it's really uniquely designed for our population that we serve in our county. And we're really trying to work to build relationships over time. One of the differences of Help Me Grow versus just a referral to a provider is that the care coordinator follows up with the family if they agree to it, to ensure that they're getting connected to the service. And if they're not getting connected to the service, what's the barrier to that connection? And so that Help Me Grow leadership can start to dialogue about why are we not getting families connected to services? What's the troubleshoot? Who's the person that we need to talk to ensure successful connections? So we just launched a new video that we are sharing currently on our social media platform on Facebook, but this is just a little video vignette to share a little bit about what Help Me Grow can do.
This is Emily. She is 18 months old. Right now, she is learning and growing more than at any other time in her life. However, Emily's mother, Melissa, has questions. She doesn't know if Emily is talking or playing as much as she should be for her age and isn't sure how to help her. A developmental screening is a free tool that can help Melissa find answers. Developmental screenings provide a quick check on a child's development. They give a snapshot on how a child is learning, moving, communicating, and playing. Screenings show a child's strengths and any areas in which a child needs more help or practice. Catching and providing support for children's development before kindergarten can make a big difference. Help Me Grow Butte is a local program that is helping to make sure young children like Emily can access developmental screenings and support. Help Me Grow Butte connects local services to create a network of support for children ages 0 to 5 and families. Healthcare providers, early learning providers, family support services, and other agencies can all participate by conducting developmental screenings and by referring families to Help Me Grow Butte. Help Me Grow Butte provides a centralized system to help families and professionals connect with resources so there is no wrong door for getting help. It also offers free developmental screenings over the phone or online to any child aged 0 to 5 that needs one. Help Me Grow Butte provides outreach and education in the community to ensure that all children are screened, and it works to improve the systems that support children and families. Here in Butte County, Help Me Grow Butte is a partnership between several local agencies who are working together to make sure families have access to the resources they need. It is funded by the First 5 Butte County Children and Families Commission. Thanks to Help Me Grow Butte, Melissa is able to find the support she needs for Emily. Melissa visits the Help Me Grow Butte website, where she can complete a free developmental screening online. A Help Me Grow Butte care coordinator follows up after Emily's screening. The results of the screening tell Melissa that Emily may need extra support, and that her family might be able to access local services to help. Melissa is given a referral for follow-up and information that she can share with her pediatrician and child care provider. Melissa is also able to ask the Help Me Grow care coordinator questions and get information to help support Emily's development at home. Because Emily's developmental concerns were caught very early, services are more likely to be effective, and she is less likely to need support when she starts school. Help Me Grow Butte connects families to information and resources they need to give children their best start in life. Learn more about Help Me Grow Butte at www.helpmegrowbutte.org or by calling 211.
Sorry. So Help Me Grow really is the formula for success. Like we said, that screening is really critical and important, both in healthcare practices and an opportunity to have free screening done through Help Me Grow. We really are trying to increase that access. Early learning and care providers are conducting ASQ screenings throughout the county. And pediatric offices, we're trying to encourage screening and really reducing that gap. Care coordination for referrals is key to getting families connected to services. And the best part about Help Me Grow is that it's free regardless of income or immigration status. So oftentimes there's some sort of qualifier. Are they Medi-Cal eligible? Then, yes, we can provide service, or no, we can't provide service. Help Me Grow helps navigate the resources that are available for a family, or like I said, identify the gaps in our community so that we can access funding to support them long-term. And then also keeping the medical home informed. So and we'll talk a little bit more about the sequence of care coordination in a future slide, but the most important thing is if they're coming through the Help Me Grow system and haven't been talking to their pediatrician or healthcare provider about their challenges with their child, Help Me Grow will loop back in the healthcare provider to the information of support that they're receiving through Help Me Grow. So Dr. Valdez may have mentioned that cross-sector collaboration previously, and where we're starting to build bridges between early learning and care systems and systems of healthcare, and really being able to maximize the amount of time with children and families. We recognize, Help Me Grow recognizes that there's a lot that needs to be accomplished during their well child visits. And there is a lot of apprehension about that development, the complete developmental screening opportunities. That I don't, what we hear is I don't have enough time during my, well child visits to fit in something like developmental screening. And that's another partnership that Help Me Grow can offer, is that we recognize, although we really want to see it happening in the medical home, that there is an opportunity to have Help Me Grow do the screening with the family, and then that loops back to the medical provider. What we can have doctors' offices do is give the information to patients about Help Me Grow, so that in between a visit, if they have a question or concern, they can call Help Me Grow and receive supports regardless, and especially if it's related to something like a basic need. We have brochures and flyers that could be posted in offices. We even have little trifold that can sit on a countertop with a QR code for families to access information. Doctors' offices can refer to Help Me Grow by fax. We have a form available that can be filled out for referral. We also have an online portal through our website that a office can use to facilitate a referral, or a parent can self-refer as well. And then, like I said, partnering with the Help Me Grow for ASQ screenings. The types of referrals that Help Me Grow offers are really robust. So we can help a family navigate referrals to Far Northern, an early start, or to a school district. So that doesn't necessarily have to come out of the healthcare provider's office, although it can be done in tandem as well. Childcare needs, we have an understanding of all kind of the childcare systems in the county. And so navigating what might be a best fit for a family. Is it state funded preschool program? Is it a Head Start? Is it a private childcare, family childcare home? We're able to help make those types of connections for families. Like I said, basic needs services, mental health services, early childhood mental health, play groups, weekend activities. It kind of runs the gamut that we have access to information to be able to connect a family to a type of service that might support them. So when, where, and how to refer. So like I mentioned, there is the California Early Start Program that's coordinated through Far Northern Regional Center, as well as Butte County Office of Education. Butte County Office of Education has a much smaller contract and works in partnership with Far Northern to offer early start services. Anyone can refer to Early Start with parental consent for further evaluation. So we do, if that's not coming out of a healthcare provider's office, that is something that Help Me Grow has helped families do to make those connections. And that's birth to 3. Once they're 3 to 5, local school districts is where eligibility is determined. And that is a parent that needs to request that evaluation. And they also not only can contact their local school district, but the county's SELPA can also help assist a family in navigating that, as well as, like I said, our Help Me Grow can provide those linkages. The regional center also provides services, but it changes once the child turns 3. And then birth to 5, Help Me Grow. We can provide child development information. We're providing that follow-up support, resource connection, care coordination. And so this is an example of the cycle of how care coordination works. So a child is visiting their physician for their well child visit, where surveillance and or screening is happening. And the doctor talks to them about how their child's growing, developing, talking. Are they rolling over? Are they turning their head? Are they saying a few words? And then during that time, they're identifying if there's any concerns that are happening. say the parent, like in the video, they're kind of worried about their child. They don't have as many words as they think they should. The physician can make a referral or let the family know that they can contact Help Me Grow, one way or the other, and that gets them connected to the care coordinator. That family engages in a conversation to better understand at a lengthier time. Sometimes phone calls take as much as 20 minutes to really understand what's going on in the household and with the family. And the developmental screening information also can help tell a story about that kiddo. And through that, the care coordinator is developing kind of a plan of what resource and referrals might be best suited for that child. The family connects to those resources, hopefully, and then the care coordinator follows up, and that information loops back to the healthcare provider. And so Dr. Valdez was going to share a little bit about her experience with Help Me Grow and participating in this care coordination loop.
Yeah, thank you, Michelle. Yeah, so I'm gonna follow the loop with a story. So I had this number one, well-child visit is Hispanic mom, and other than the ASQ, this kid is 3 years old. We also do what is called a whole child assessment that includes actually ACEs questions as well, and also social determinants of health like food insecurity, housing, or others. So this particular kid was having some speech delay by the ASQ, and also there was some food insecurity and a social situation that was difficult for the whole family. So I did the referral to, asked the mom for permission to refer to Help Me Grow, and that should be documented in the chart. Some organizations would like the family to sign a release of information paper, but I think that's not really necessary. Just documenting on the chart that you're making a referral with the parent's consent should be enough. And then explain to them what Help Me Grow is, that somebody is going to contact her from Help Me Grow, but she's free to call like today, So, and the care coordinator is bilingual. What happened next is I get a report, a paper faxed to my office that says that the care coordinator has contacted my patient's mother, and she, in this case, she connected her with Promotoras, that is a group of Hispanic volunteers that help the Hispanic moms navigate through the system. And she was able to enroll, when I see the mom the next time, she was able to enroll her child on preschool so she can receive the speech therapy. Also gave the mom emotional support for the social issues that she was going through with her family and some extra counseling. And she was super happy. And she was very thankful to 211. That's what she says, because kind of the names got confused, but that's okay. It still Help Me Grow connection. And actually share about Help Me Grow or 211 to other moms that she knew they were needing help. So it's not only an effect that we're having on this particular patient and her mother. I mean, we're trying to really involve the whole community. And it was a good reminder for me too that Promotoras even existed. I knew about it, but kind of at the moment that I'm doing the referral, I totally forgot I had that information, because it's hard to keep up with all these services that are available in the community when we have to keep up with how to treat COVID or all the other things we have to do, or how to address ACEs. So I think this collaboration really is my work, and the main thing is the patient got what they needed. And it's something that before I used just to give pamphlets like, oh, maybe you should call these Head Starts. And my pamphlets were old and not up to date on what Head Starts are even working for this community. Well, the case coordinator and Promotora, they took care of everything. Like, okay, what school district do you belong to? What type of childcare your kid qualifies for, or what counseling your mom can get to help you be better for your child. So that kind of shows the real story of what's behind all this care coordination.
Thank you. So that concludes our presentation and information about how developmental screening can be supported in a medical home or practice, and why it's important to do developmental screening and when it should be done, as well as how Help Me Grow can integrate with medical providers and providing that wraparound support for families. This is our Help Me Grow Butte website. This is where referral forms are hosted, as well as, like I said, that online portal. And anytime you can also just dial 211, and 211 can also provide that support. But we want to open it up in case there's any questions from the group.
Just remember to unmute yourself if you have a question that you want to speak.
Yeah, we have a comment about how promotoras are so good to our community. Thank you.
Indeed. Well, all right. Well, we really appreciate your time today, allowing us to present to you all. And if there aren't any questions or information, we hope that you can, our goal is for everyone to take this nugget of information and share it back, or think about ways that in your role and what you do, how that cross-sector collaboration connection can elevate services for 0 to 5-year-olds. All right, we'll turn it back to you, Christy.
All right, well, thank you everybody for joining today. And we have recorded this, and I'll be posting it on the Butte-Glenn Medical Society YouTube channel, which then you can share that link with anybody if they missed this presentation. So thanks so much.
Bye, everyone.
Bye. Oh, congrats to your new role.
Thanks, Gretchen.
Yeah, I miss Heather. We were really close. So she's like,